When was the last time that you lost it at work with one of your patients because they are badly behaved? Like with a patient who wouldn't sit still or try to bite or scratch you or just wouldn't stop barking. I had one of those barkers just this past weekend where I could just feel my stress levels climb and climb and climb until I was ready to storm out of the building in a huff and slam the door dramatically behind me. It's funny, we talk a lot about the challenges and stresses of working with people, but I don't often hear anyone talk about the stress of working with non-cooperative patients, which for me personally is a major stressor. Like, I just want to help you and I just want to get my job done, but you're making it so hard by being so bloody difficult. Dr. Dennis Wormald wants us to take another look at that word, difficult, when it comes to our patients. Dennis is a veterinarian with a deep-rooted passion for understanding and addressing canine behavior and anxiety. His entry into the world of animal behavior began before his vet degree with a biomedical science degree with a neuroscience major and research experience in addiction neuroscience. An increasing interest in behavior during his years as a GP vet led to a PhD in canine anxiety in 2017 and to Dennis attaining membership by examination of the Australia-New Zealand College of Veterinary Surgeons Behaviour chapter. Since 2021, he's been working solely in behavioural referral practice. He's also the founder of abadog.com, a platform that he initially designed to make his own behavior consults better by collecting all the important behavior history for you and then collating the information to create a tailor-made behavior plan for the patient. And in 2023, Dennis added author to his bio with the release of A Dedication to Difficult Dogs, a heartwarming tale shedding light on canine mental health. Of course, you'll find the link for both of these in the show description, wherever you're listening to this. I totally stole Dennis's book title for this episode because that's ultimately what this conversation is about. Not the book, but about Dennis's mission to help us and our clients better understand the root causes of the behaviors that lead us to unfairly labeling our patients as bad dogs or naughty dogs. It's about a paradigm shift in how we think about behavior, both as it pertains to the behaviors we have to deal with as vets on a daily basis and to how we respond to those behaviors, as well as when clients come to us for advice about their pets' undesirable behaviors. It's about reframing difficult from meaning bad to needs a little bit of extra work. In this conversation, we talk about, amongst other things, what it is about behavior as a field in veterinary science that puts so many people off it, why so many of us are so bad at it, and why getting better at it by increasing our knowledge and our empathy won't just make you a better vet, but also a safer vet and reduce a lot of your work-related stress. Dennis also shares some practical strategies, tips, and tools that will instantly lift your game in your next behavior consult and your general interaction with dogs. We've also previously had Dennis as a guest on our clinical podcasts talking about behavior stuff, including a great practical guide on behavior medication drugs, sedatives, and anxiolytics. Go check it out at vvn.supercast.com, along with more than 400 other episodes in small animal medicine, surgery, and emergency and critical care, all backed by our super popular show notes. Okay, let's jump in with Dr. Dennis Wormald. Welcome to the Vet Vault, mate.
Thank you, Hugh. Hi.
We've had many conversations off air and spent lots of cool time together doing fun things. So it's a privilege to have you officially on the podcast so we can capture some of the cool stuff that you have to share on air for the rest of the world. So thank you for making the time for us.
Oh, no worries. Yeah, unfortunately, it's probably going to be a bit like when you try to take a photo of your cat that just did something really funny, and then as soon as you hold up your camera, it just stops. But we'll see. Hopefully we catch some good stuff here too.
Maybe we should record this walking through a rainforest in Lombok, across a rice paddy through the mud. That's where we've had our best conversations, right? It was hiking across Lombok, swimming in waterfalls together.
Oh, I think about that almost every day.
Yeah, we've got to get that up and running again. Oh, man. Anyway, let's start with my standard kickoff question. Bad decisions lead to good stories. Yes or no? And do you have, and you can disagree. I've had people disagree. But if you don't disagree, if you think there's something to it, do you have any stories to corroborate, to support that statement?
Bad decisions, good stories. I think bad decisions, you'd say that's a mistake, right? And good story is maybe something positive. So learning from your mistakes, absolutely. Absolutely. I think we all learn from our mistakes. One of my, it's not really vet related, but I do remember some things one thing I do regret is back in 2011, just after I'd graduated, I was waiting for my first job. I was reading New Scientist magazine and I saw this thing called Bitcoin in the magazine. I thought, oh, and I saw you could mine it online, like use your computer to calculate it. And I got my computer out and I started mining away for hours and hours. And it took me ages to set up, and I spent all this time on it, mined it for a few hours, and I got like half a Bitcoin in like 2 hours. And I'm like, oh, it was worth like $1. And I was like, oh, that's not worth it. $1 for an hour's work, like 2 hours onto the computer. Like, that's just a waste of time. And so I just completely forgot about it and left it and never opened it up again. And it was kind of a bad decision at the time because it wasn't worth the money, but maybe it was a bad decision to actually stop doing it and not commit. Maybe it's saying we need to commit 100% when we do things and not just fluff around and go halfway. So, but yeah, needless to say that $20,000 is gone.
What? So you had a half a Bitcoin? You don't even have the half a Bitcoin anymore, did you? How did you?
No way. That's on an old laptop that's gone a long time ago and lost and forgotten about. Yep.
That's not a good story. That's a tragedy. Wow. So you were first in on Bitcoin, one of the very first people, and then went, no. I mean, I've got stories like that. That's why I cringe, because I have enough stories like that I go, yeah, I could have been, coulda, shoulda, right? It's easy in retrospect to look back on things you should have done.
Yeah, absolutely. It was just when mining pools had opened up, so like a online like pool you could join up to and mine as like a conglomerate, like a whole bunch of other computers. And so yeah, the amount I mined on my little laptop then would now take like a room full of servers, like hours to mine. So it's gotten a lot harder than it was back then.
Wow. Yeah, I always forget with all the stuff that you do and all of your knowledge that you're really techie as well. Let's take a quick detour. How did that happen? Because I know you do computer stuff, right? That's one of your many talents.
Yeah, and it makes me feel like a bit of an outsider in the vet world, to be honest, because there's not a lot of really techie, geeky technology vets out there. And so, fair enough. I mean, it's almost like opposites in terms of the skills that you need and everything. It's very focused on like little minutiae in almost mathematics and code. Yeah, I've always been into it and always been into just hacking away and figuring out how to get things to work, like old computers and stuff when had no money, not much money growing up, had to keep them working, and so I'd figure out ways of fixing them and have to write little bits of code sometimes, or fix drivers and stuff. And it's just, I think, a real persistence and not wanting to give up and just keep trying, almost like bashing my head against a wall, like not giving up perseverance in terms of getting things to work through computers, that I kind of enjoy it. It's almost sadistic. Like, I like going through that pain and trying to get things to work, because once they do work, that endorphin rush you get from finally going, yes, I got it to work, it's great. And I just kept on pursuing that until I ended up knowing how to, program and all sorts of stuff. So, yeah.
I think you just answered one of my future questions. So we're going to talk about animal behavior, obviously, because that's your big thing work-wise. And one of my questions was going to be, why do some people like behavior? And then why do most of us, I'd say most of us, but yeah, it's not a lot of people are really into behavior, right? And I was going to ask why, but I wonder if that's the answer there, because it's freaking hard and you bump your head against the same thing. And most of us most of us just go, fuck it, too hard, send it to somebody else. And you enjoy the bashing of the head.
Do you want me to answer it now or later? Because it's a bit of a different answer.
Okay, go for it. No, tell me.
Well, I think with behaviour, that one doesn't feel like bashing my head against a wall, to be honest. But I get why it does for every other or most other vets. Like, I completely get it. It's because it's a foundational subject and a foundational topic. And by that, what I mean is when you're learning about internal medicine, you're relying on all of your undergraduate physiology and biochemistry without knowing that that's all in the background, and that's your foundational knowledge to then be able to understand the disease process. And with behaviour, unfortunately, vets don't come out with any behavioural foundational knowledge, or next to none. And it needs whole semesters and whole subjects, just like how you need your physiology and stuff to understand internal medicine. And it's exactly the same. And so, yeah, that's why it feels like bashing your head against the wall, I think, because you've never been taught the underpinnings of the theory behind it.
That makes a lot of sense. And it's like that, right? With clinical stuff. If there's a gap in your knowledge on whether it's dermatology or your lecturer in whatever topic wasn't that great, or maybe you had a hangover on the day that you covered the foundational stuff back at uni, or you just and you get into work and you'll always have that resistance because you go, I don't get this. I don't like it because I don't get it. And if you go to continuing education at a later point, or you commit some time to restarting, to getting back to the roots of it, that's often when it clicks and you go, that doesn't suck nearly as much as I thought. I kind of like it because I can get some of it. I used dermatology because that was me with dermatology, for example. It just frustrated me. And then I did a bunch of CPD in it, and I suddenly went, it's actually quite cool. I know what I'm doing.
Absolutely. It's I find that you enjoy things more when you actually are good at it, and I think that's a pretty common experience.
So yeah, the behavior thing specifically, and I'm curious if it's changed. I mean, it's been a long time since my vet school days, but certainly for me, like my bias against behavior, because literally my behavior education at vet school was like, I think we in first year or something like that, we had a little session on behavior basics. And we had this guy who was in his 60s, old school vet, with, if I recall, it was actually a cow vet, came in and talked to us a little bit about animal behavior. And the gist of it was animals are not humans. They don't anthropomorphize. How do you say it? Anthropomorphize. Help me with that. I'm stuck in it.
Anthropomorphize is a tongue twister.
Don't ascribe human thoughts and emotions to animals. They don't feel like us. They don't think like us. That was my foundational behavior knowledge, which I feel like is very damaging. And still, even when I read your book and we talk about behavior stuff, that little voice still comes up in my head as like, I don't know if I believe all this stuff because it's just an animal. I don't know if it feels that. Do you still find that? Is that, I'm sure that they don't teach that at unis. Has it changed? Is that foundational knowledge in our current graduates way better than it used to be?
I think it's slightly better. I think we've gotten better, as a field in terms of the high level gold standard behavior has improved a lot since we both graduated. It's improving all the time. But I do think that there's still not enough time dedicated in the course. And there's only so much you can teach in a limited amount of time for any subject. And so imagine if you had to go through all of your animal physiology in a week. For all animals, for all species, all animal physiology in 1 week. Imagine where you get to as a vet after that with that kind of foundation. So it's, obviously that's always going to be a problem as long as there's not the time dedicated to it. It's not, because it's out of left field in terms of, like with different species, you can, say, if there's a disease that affects this body system in one species, you can then be comparative and think about another species and, maybe with wildlife or something when they're coming in, even if you don't know exactly the disease in detail, you've got all that backup knowledge from related species that you can just pull across into your mind and give you some first principles when dealing with something outside of the box. But you can't do that with behavior because you haven't got something else similar enough that you can then pull across that knowledge, because it's all behavior theory. It's like, your conditioning, your learning theory, your animal signaling. It's all sorts of stuff that's just not taught in detail that needs a long time to get that into your brain. So it's tough. It's really tough. And I empathize for vets. Absolutely. I feel bad. I don't blame vets that aren't good at behavior or think they're dumb in any way at all. I think that we are expected to be jacks of all trades and we can't be. It's just unrealistic. We all hopefully understand that by now. Yeah.
Okay, a couple of places I could go with it. The first, and I don't know if it's too big a question, so you can say, no, we don't have 3 days to talk about this. But let's say you, Dennis 2023, is sitting in that lecture that I had back in my day with that dude talking about animals and how they are very different to us. Dennis puts his hand up and says, "Excuse me, Prof, what do you say? What feedback can you give to that statement?"
I think I would say that yes, animals are not humans, and it's important not to anthropomorphize too much with them, but I think it can be healthy to anthropomorphize in some ways. I think, especially if you're thinking about animal welfare and pain and stress and anxiety or enjoyment of life, because that part of their brain that feels the world, that has sensations and feelings, it works the same way in them as us. So when they feel pain, it feels pretty much like how when we feel pain. And when they feel scared, it's like when we feel scared. So I'd say that if you don't anthropomorphize in that sense, you lose a lot of chance for empathy and compassion towards animals, because if you don't imagine how they could be feeling bad, it's hard to have that same level of care, and particularly in behaviour as well, because these behaviours that people and vets are dealing with that are caused by things like stress and anxiety and fear, they're often very unpleasurable behaviours for us as humans to experience. Things like ear-splitting barking, destructive behaviours in the clinic, you know, the chance of being bitten and injured. So it's almost like they're trying to make us not empathise with them by the things they're doing. And yet, if you can understand really and see and feel what they're doing and why they're doing it, that helps go a long way with empathising. I think that's what I'd say.
It's a good answer, and it actually makes you think quite a bit, because I think that approach of they don't think the way we do, they don't worry about stuff ahead of time, or they don't ruminate about the past like we do, gives you a cop-out. It sometimes makes things easier to go, well, I can do these things. I don't have to spend time or energy or emotional energy thinking about their feelings. I can just get on with my day, versus having empathy. And I like what you say there, to say, oh, they're not human, but rather err on the side of caution, rather over interpret what they're feeling or could be feeling and compensate for that, then go the opposite way and underestimate it, and then inadvertently or unconsciously cause suffering. But that approach of feeling for them is harder, because now you have to think about it. Once you've empathized, once you go, oh shit, I think you're feeling this and this and this, now I've got to do something about it. And I think maybe that sometimes we conveniently just ignore it. Is there something in that? Do you agree?
Yeah. Yeah, look, I think one thing I'd say is I don't actually think it's erring on the side of caution to think that animals are feeling like that. I think it's pretty well scientifically understood, and it's not controversial, that animals definitely are living in the moment. When they are living in the moment, just like when we're in the moment experiencing something we're feeling or touching, that experience is going to be very similar between species, given the similarity in our brain's anatomy. Yeah, so I forgot your original question, because I just wanted to make that point.
No, that's good. Thank you for pointing that out. No, it wasn't so much a question as a statement, just to say that it makes work almost harder, because you have to think about it. Once you have that empathy, now you've got to do something about it, right?
Yep, absolutely. It's harder until so anytime you're learning something new, it's harder, absolutely. You've got to put in more time and effort to address learning a new skill or thinking a new way, but then eventually it becomes normal, and it's not really much more effort at all, and you can connect better with your patients. So, for example, me and other vets that I know that really get this well, when they see these really stressed, aggressive patients, it's not as stressful on the vet themselves, because it's kind of like the difference between if you see someone, you know, maybe road rage, they're cutting you off, they're beeping at you, and you're like, oh, what an asshole, like, I can't believe they did that, and you might get angry back at them and really upset. Versus if you see someone do that, but then you see that they're mentally unwell, like they're in tears and they've just cut you off, you think, oh wow, they're actually really unhappy. Maybe they've cut me off because they're driving to a funeral or something like that, and they're stressed. And so I think that it can really help with the dog in the consult if you can see that this dog actually isn't just a mean, nasty dog, and you actually feel that, oh gosh, this poor thing, I feel bad for it. It's still not going to be nice dealing with that dog, but I find for me it gives a buffer to some of that stress that you feel when you really understand that, and when you actually see it in your patient.
That's really cool, because that's something I harp on about with client interactions. Exactly what you talk about. The client that acts in a way that you don't like because it's not the way you expect, or they're rude, or they're short, or they're angry about money and stuff. And having empathy or compassion for them, but not for their sake, for your sake, because not having it is exhausting. It's exhausting to work like that, versus going, well, yeah, you're angry about the money. I get it. I would be too. let's find a solution. But I haven't thought about it that way about my patients as well. You said the word, that person who's an asshole, but how many asshole dogs or cats do you deal with? And I get angry about it. That's the thing.
I deal with zero. I deal with none. No asshole patients, dogs or cats ever, because to me, they're never assholes. To me, they're always just suffering. And that's actually how I feel. I'm not lying.
Yeah, that's a massive shift because I think I'm better at it as I'm mellow as I get older, but I used to get angry at my patients when they want to bite me, or as you say, they sit and they bark, or you can't look in the eye because it's freaking out, and you want to go, you stupid fucking dog, I just want to do my job, just sit still. It's so frustrating. But I like that flip to go, you poor dog, this is terrible for you, let's find a better way.
Absolutely. And it's not a conscious thing for me. I look at the dog and I just feel sad because it's just become so obvious to me when I can see a patient suffering and when they're sad and scared. And I think it makes you a better vet, and it also means that you are able to actually be safer as a vet if you can empathize, because if you can tell when they're scared, then you're going to be safer. You're less likely to be bitten because you're not going to press through their boundaries as much. So it's all integrated. It's all so important. And it's a bit sad that there's not enough time in the vet course so that everyone can come out having this knowledge, but it's just how it is, unfortunately.
You kind of develop, I find that some of that develops with time, the understanding of the body language, and starts coming naturally. But I still think the foundational knowledge, the understanding of where it comes from, is important. That's why I like your book, Dedication to Difficult Dogs. A euphemism, difficult dog. I should have called it a dedication to asshole dogs. Or cats. Do you talk about cats in the book, by the way? I've read most of it.
Hardly at all. In this book, I have really strived for real accuracy as much as I can get it. So I've got a PhD in dog behaviour, and it's my real passion. And I feel like the type of writing I'm doing, where I'm really trying to give the reader as accurate as possible an understanding of the true dog experience, I don't feel like I can do that with cats yet. Like, I've got a cat and I understand it well, but it's just not the same level of understanding. That narration from the animal's point of view.
Yep. Quick interruption. We're talking about difficult. Do you know what else is difficult? Being a practicing vet and just trying to remember all the important stuff that you've learned over the years. Never mind staying up to date with what's new and what's important without spending all of your free time reading journals or attending webinars and conferences. If you're new to this podcast, you might not know about our other podcasts, the Clinical Podcast Series, where I ask all the questions I've ever had about my tricky cases of the people who are the best in their field on that topic. If you're a regular listener, you'd have already heard me go on about it. So I thought, instead of me telling you how great these are, I'll read you a testimonial we got this week from one of our subscribers. This one is from Helen, and Helen says, "The thing I love most about the VetVeld Clinical Podcast is that they deal with relevant clinical topics. Not just the theory behind the disease, but how they clinically present, what to look out for, and the latest information about what to do about the disease. I also love that it's the who's who of that disease that's getting interviewed. It's like going to a conference with the best dermatologist, the best endocrinologist, and the best feline specialist all in the one place. And I love that Hubert asks all those questions that you as a clinician want to ask. The episodes are short, usually less than 30 minutes, so you can easily fit it into a busy day. And I also love the show notes and the website." Helen, I love this email, and I love the work that you do. Thank you very much. Our clinical podcasts live at vvn.supercast.com. You won't find them on your podcast player until you've signed up. Okay, back to Dennis. So let's focus on the dog part of it then. Difficult dogs, aggression, destructive behavior, digging, barking, all the behavior issues that we get asked about or that we see in our patients. Because the subtitle of your book is A Heartwarming Tale Shedding Light on Canine Mental Health. And that reframe that those things that we don't like in our patients, it's not a bad dog, it's a mental health problem. That's my takeaway from the book.
Absolutely, yeah. In so many cases it is. So a good little way of thinking about it is, if you're going to change a behavior in an animal or a human, if that behavior has got a very strong emotional motivation behind it, then it's going to be very hard to change in the moment. So just think, if someone's really angry or really sad, if they're doing something, it's going to be harder to change their behavior than if they're calm. If your house is being robbed and you're looking at your partner and you say, hey, can you go and do the dishes for me? They're much less likely to be able to do it while your house is being robbed than when it's not, because emotionally they're just coping with their current emotions in the way that they best can. And so if there's an animal that is really fearful and worried, and so they're barking because they're scared, for example, if it's a dog, then training that dog to be quiet, you're not just training a behavior there, you're actually dealing with trying to counteract a strong emotional motivation. And so, these emotionally driven behaviors have got such a strong motivation behind them that changing them is very difficult if you're trying to ask for a change that means that they can't cope with that emotion anymore. It's very difficult. Basically, what it means is that the difficult dogs, the ones with difficult behaviors to fix, they're pretty much all ones with behaviors that are emotionally driven. Right? So the behaviors that aren't emotionally driven, there's plenty of them as well that they're just doing because they're doing. They're very easy to fix, very easy to change. The dog isn't really strongly motivated to do them. And so all the strongly emotionally driven behaviors are due to mental health problems, the difficult behaviors. So like your barking, aggression, destruction, all of that. If they're hard to fix, then there's probably some stress or anxiety causing them.
Give me an example of an easy fix one. I'm just trying to keep track of what we're saying. So a behavior that we don't like that's going to be easy to fix.
Yeah, absolutely. So a good way is thinking of all of the puppy behaviors that are normal. So just like a dog that's chewing up things that they're not meant to, right? And then you just put those things out of reach and you leave them things that they're meant to chew, and they'll chew those things up and they won't chew the other things up. They'll learn a habit. Eventually you won't need to keep the shoes away because they are so used to chewing everything else that they've been taught to chew. That's just their habit and that's what they do.
That behavior is not emotionally driven. It's a behavior. I'm a puppy. I'm exploring the world. I'm chewing. I'm not chewing because I'm anxious. I'm chewing because I'm like a great white shark. I always say puppies remind me of a great white. Everything has to be chewed. and that's why it's easier to fix.
Completely right. Yeah, it's just a normal behavior. As long as their needs are being met, right? And that's the other side to the coin. Like, yes, they're going to be difficult if they're simply being completely deprived of stimulus and they're in an empty room, then they're going to start chewing anything that's there and they might be really stressed. But then again, it becomes an emotional thing. So for a normal little puppy, they're exploring the world. Absolutely. They're chewing because they're teething, because they're interested, because it's fun. And so, there's not a strong negative emotional driver there. Versus in a mental health condition, there's some dogs that when they're left alone, they get so stressed that to cope with that stress and anxiety, they have to destroy something because it gives them a job to do. It's enjoyable to destroy something for them. Like in the moment, they're enjoying it and it's helping them to cope. And so because it's what they have to do because they're so stressed and it's their way of dealing with it, that is then a strong emotional motivation to that behavior, and it's going to be difficult to fix it.
Trying to think of a comparison in humans, like to make this sink in for myself more, and also to explain that to a client.
Maybe OCD or something. So if someone they get really stressed if the bench is dirty and they have to keep it clean, and if it's dirty at all, they get extremely stressed and they have to clean it. Versus someone that just cleans the bench for the house to be tidy. And then think about how hard it's going to be if your goal was that you wanted to have stuff on the bench because you needed it out there to use, how hard it's going to be to keep that bench cluttered with someone around that's got OCD that has to clean it. You're going to have a battle on your hands versus someone that isn't so obsessive about it. That's a off-the-cuff example. That's maybe not perfect, but...
Yeah. So what's the neurology behind that? I know part of your background is you did neuroscience or neurology as well. What happens neurotransmitter-wise when that dog is destroying the couch because he's anxious that makes him want to do more of it?
So what I'll say firstly is just a disclaimer. So because I've done a behavioural neuroscience in my undergrad before vet school, and basically one of the key takeaways I took is that whenever you read something where there's like a simplified explanation for how things work in terms of neuroscience, it's probably simplified and it's not the whole picture because it is never simple. So basically what's going on in a broad overview, I believe in a lot of those cases, is so the dog's got a negative emotion like anxiety, and so they're feeling stressed and worried. And the brain is wired that when it's in a state of distress, or that alarm system, that anxiety and fear, when those bells are ringing in the brain, that it worries about basically survival and needing to survive. So it looks to produce behaviors in the animal that will aid with survival and getting safety. And so if that's not an ability, if they can't get back to you and get safety, they've got to do something. Like, doing nothing is not an option. They need to do something in these dogs. And so they're going to pick to do something that has some reward, some intrinsic enjoyable value, and that also helps get rid of their frustration. So a bit like punching a punching bag for a person, or something physical outlet that they can help to deal with some underlying stress. So doing nothing, sitting there and having your worry and stress ruminate in your mind is often something that we recoil against. We go to screens or exercise or something to deal with it, drinking. There's all sorts of things we do to cope. And so dogs don't have many options. And chewing up something and chewing things, it is an enjoyable behaviour for dogs. There's endorphins released. There's opiates in the saliva that's produced from chewing things up. And it's an active behaviour, which means that they can feel like they're going to have an underlying need and want to do something active, some of these dogs. So it depends on their coping style, but a lot of dogs want to do something active, but not all of them. That's a personality thing, how they're responding to their stress. That's why all dogs don't do that. But the ones that do, they need something active to do. That's why they're being destructive.
And does the same go for barking, the ones that will get complaints from the neighbors, or the one in hospital where you put it in a cage and it cannot shut up? Is that the same thing? It's an active thing?
It is, absolutely. It's active, and it varies in terms of, I think, how much they're thinking about and deciding to do it versus it's sort of just a knee-jerk reaction. So with barking, I think it's a lot like crying in people. So there's lots of causes of barking in dogs. Obviously, it can be all sorts of communication and things like that. But for the dogs that are really panicking and stressed, that have got that repetitive bark when they're left alone, I do think it's very similar to crying and wailing in people. And so it's, why do people cry and wail when they're sad? I don't know. It's cathartic. Like, you kind of just do it. You can't help it. It just comes out, and it's just a reaction to your emotions. Yeah, and I think that's very similar to what we see in dogs, particularly when there's fear or stress or anxiety causing it. Yeah.
It makes me feel really bad for how frustrated you get at work when there's the dog that won't stop barking, and again how angry you get at it. And now you just told me it's not barking for fun, it's crying and wailing, and then you go in there and say, oh, just and I know you don't mean it, but you want to go, just shut up already, I've given.
No.
Yeah.
Don't feel bad at all, Hugh, because it's normal. It's because you have some degree of empathy that even happens. So just think in humans. If you're in a house and there's someone crying next to you, it brings down the mood. You get a bit sad yourself. That emotion sort of spreads. Just like in flocks and herds of animals, if one animal gets really anxious and bolts, the whole herd is on edge. So emotions spread through social animal groups. They spread like fast, at the speed of our brains. They spread through smells, through behaviours, through actions, through pheromones. And so you are actually catching the emotion off the stressed dog, and you're feeling the stress because that's what they're feeling. And so just the same way as if someone's yelling angrily next to you, you start to feel similar, like scared or upset, like they might be feeling when they're yelling. So it's human nature, it's mammalian nature, it's just how it is. You don't have to feel bad. But I think what happens is then how you deal with that feeling when you get it. So you do get that initial stress and anxiety or worry or from hearing that ear-splitting bark, and you're going to get that feeling. I get it too. But then it's after you get that, you stop and think, okay, how am I going to deal with this emotion myself?
Because again, over the years, you do also get used to switching off to some of those signals. There'll be a barking dog and you've got a busy day and you've got surgery to do with the one's barking, and the nurses keep coming and saying, that dog's really barking. And then you want to say, yeah, just ignore it. I've got stuff to do. But no, that it's upset. It really does probably need some sort of attention.
Can you give it its pre-medication injection early or something like that? Like, is there an option around it? Does it have to be given just half an hour before the surgery? Can it be given an hour and a half or whatever?
Yeah. What about, and again, I don't want to turn this into a whole behavior consult, behavior for dummies. But it is fascinating. It's more about the mind shift and the way that we think about it that I think I want to get out of this for vets listening to it. But what about aggression? What about and again, for us, practically the ones that we worry about for selfish reasons are the ones that get bitey, spicy, like they call it in Spicy Cats, in the consult room. That, I'm assuming that's an anxiety thing, right? The dog that wants to have a go at you, it's because it's scared for the vast majority of them?
Absolutely, yeah. So we can talk about exceptions if you want, but yeah, if you just had the rule in your mind that they're biting you or attacking you because they're scared, you'd be right 98% of the time, I reckon. Fear and anxiety. And I get it. Like, imagine that you couldn't speak the language of your doctors and you go to there and they can't tell you what they're going to do and they just start jabbing needles into you. Like, a lot of us would get pretty scared too. Makes sense.
Yeah, I always joke and say if it was socially acceptable, I would definitely bite the dentist. I'm shitting myself. What about the whole, like, what we used to call the dominant dog? And I immediately think about the Rottweiler that's there, and I look at him and I go, you don't look scared of me at all. You're just going, I'm stronger than you. Touch me and die, bitch. Is that a thing, or is that still fear at the heart of it?
Absolutely still fear. So there's a lot of bravado involved, so kind of like if you were about to go into if you as a person are about to fight someone else, a lot of people will act very tough and macho. They'll act as strong as they can in order to intimidate their opponent and scare them off. It's a really common tactic in the behaviour world, is that you actually want to avoid aggression by having a display that shows your opponent that you're going to be so strong and tough that they shouldn't even bother trying to fight you. Then you don't risk being injured as being the other animal, and you can still win that confrontation and get out of it what you want. So if this Rottweiler can scare you so well that you didn't even bother trying to do any of your vet stuff to it, you just leave it alone, then that's actually what they want. So they're going to act as tough and as strong as they can. And on the inside, they're just a big baby. And Rottweiler owners will tell you that when they're on the couch next to them, they tell you these dogs, they're just big sooks, big babies, they're sweethearts. It's just they've learnt to deal with their fear and worry by using aggression to stop bad things happening to them. And I get it. I get why you do that.
So what do we do with this? Two scenarios again. So the way I see behavior for vets, practically clinically in your day-to-day work. So now, and again, you have that chapter in the book about the two different anxious dogs visiting the vet hospital, which are super insightful. I think most vets should read that to have that empathic view of what it's like for these dogs. But we have to get
vets and the nurses in the clinic too, because how many times I've seen a nurse that goes while they're holding the patient and trying to, just that mindset of no, you're doing the wrong thing, trying to teach the dog a lesson when they're already stressed and worried and scared. And it's, or cats as well. And I think if they read the book, they wouldn't do that anymore. If you know what I mean, like that wouldn't be their go-to.
It's maybe too big a topic, but what are good resources to go, well, what else should I do? Because the reality is we have to get a job done. So if you have that patient in there that cannot be examined or is too aggressive, or is it just drugs? Just go, okay, well, I can't deal with you, have drugs. or
Look, it's a mixture of everything. I mean, yeah, absolutely. I mean, yeah, drugs are part of the picture, absolutely. I think in terms of resources, like, become a fear-free accredited vet. Like, it's going to be a really good first step to trying to go down this path. And look at, having some of your nurses and some of your staff do it as well, or even become a fear-free clinic is one option. If you want to look at ways of getting stuff done with less of the fear. But what it boils down to really is that you can get better at making a call earlier, before you've already stuffed around for ages, as to whether or not a patient is going to be able to have done to it what you need to do without medications or not. So oftentimes I will touch an animal and be like, no, that's it. We're not doing this procedure. I'm not even going to actually attempt it. I just stop it there before I've actually attempted it, because I know that it's going to end badly. And, a lot of people, I see them, they start trying to see, what can we get away with? What can we do and get away with? And they'll start trying to do what they need to do. And the animal will play up a little bit. They're like, oh, maybe we'll just try a little bit more. And they try more, and the animal escalates and escalates. And then they say stop at the point when the animal's biting them. But I think it's better to stay stop before that, and at the point when the animal just looks too stressed. And rather than saying, okay, we've got to get things done without getting bitten, say, okay, we've got to get things done without traumatizing our patients. Because if you're not traumatizing your patients, you're not getting bitten.
I'm so guilty of that. I'm just going to try. Oh, we're almost there. I'm almost there. And again, it's a time thing because you're busy. You got to get stuff done. You got to get through the day. It's an inconvenience for the clients to go, hey, listen, I can't do this. Something simple, it's the small things that are the frustrating things. I just want to look down his ear, or I just want to make an ear smear or a quick look at this. And then to go, I'm going to admit you, I've got to update an estimate. The clients have to go away and come back later. And that's what I said earlier. It's sometimes easier to ignore these things, to be blind to it. I just go, it's okay. I just need to get through my day. And I find personally what helps me is if I start on that journey and go, okay, I'm going to try doing this, I have to set metrics for myself beforehand to say, okay, I'm going to try once. And I'll say to the clients, I'm going to try to do this. Your dog seems a bit nervous. I want to look down his ears. I'm going to have one go. But literally go not past one go. If it's a stressful event, then, and I tell the nurses beforehand, help me see and hold his head. I want to see if I can look down his ear. I'll have a go. If it's not going to work, we'll sedate. Because otherwise, if I don't draw that line, then I'll just push it. Okay, just get one more go. Just one more try. Still guilty of it, unfortunately.
Absolutely.
Happens.
And the other thing that I think I'd add to that is that also a lot of times I see dogs being muzzled or cats muzzled, and then the vet's then going on to do their examination with the animal muzzled because it's safe to continue. But the animal is still being traumatized so much that personally I wouldn't feel comfortable doing it. Now, there's heaps of exceptions to that where I would just do it, like where an animal needs immediate attention and it must be seen to right then and there. But I have many times seen a dog being muzzled and then had its temperature taken for a vaccination. And the owner says it's perfectly healthy at home. It is stressed and panting in the room. What are you going to do with a high temperature anyway on that animal? Like, it's going to come in with a high temperature every time it visits the clinic. And yet you're doing, sticking a thermometer up their bottom, which could be the reason that this dog became aggressive in the first place. And just because you can do it doesn't mean you should be, because then next time they're coming in, they've had that traumatic experience with you, and then they're going to be even more fearful and they'll just escalate from visit to visit. So I think the issue is that when you have a muzzle on an animal, I think that it's really important to still treat them as though they don't have a muzzle on, and be really careful and gentle and slow as though they could still bite you, because then you're going to be less threatening to them, I guess. I think you're not going to push through their boundaries as much, and you're going to do like the minimum that you have to do while they're awake, because it's not just about preventing physical pain in our patients, it's about preventing emotional pain as well. Like, if you can think about your duty of care as a vet, that you want to help your patients and help them feel better, are you going to be just treating physical pain, or are you going to treat mental pain as well? Because if you think about welfare and humans, for example, like if I think about the most horrible experiences in my life, they were all mental traumatic experiences. None of them were pain related. And I think for most people, they'd say the same thing. So I just feel like it's just important to keep that in mind, I guess, that as vets, if we're going to be treating these animals and making their lives better, we've got to not just look at it medically, but look at it from a behavioural point of view as well. Just part of the picture.
How did this become a thing for you, Dennis? How did your career journey lead you to caring this much about behaviour? Were they standout events, or was it just a gradual slide?
That's a really good question. I must seem like such a I don't know if this is it, but maybe like a lovey-dovey, like in touch with nature and feelings and emotions person. But I'm not like, that's not where I started at all. Like, it comes from understanding. It actually doesn't come from feeling. Like, I don't think I was a particularly empathetic person in my life. It's just that it's come through a deep understanding of what's really going on that's led me to feel it, because it's like I learnt it. It wasn't intuitive at all. It just came through understanding. It's an odd. I don't know if that makes any sense. It's
100%. It's that classic saying of once you see it, you can't unsee it. Once you get it,
that's what happened to me.
Once you get it, you can't unget it. Right. So how did that learning happen? Was that an active process? Was that part of your pre-grad stuff that you did, or what was your journey to it?
It's just been everything, because I've always loved the brain, actually, and I've thought the brain is really cool, and the way the brain causes behaviour. And it's just one step after another. I did my behavioural neuroscience undergrad, then I did my vet degree, and then I did my PhD in dog behaviour. And it's a lifelong thing, I guess. I couldn't really pick one thing, and I don't know when there wasn't like a light bulb moment where it switched on. It's like this understanding. It's just slowly opened up, I guess. That's how I'd say.
It's just struck me now, that statement you made there, that you must seem like a lovey-dovey, highly empathetic. And that's kind of maybe that's why a lot of people are also resist behavior, because it feels like it's that sort of field. There's the stigma of, it's the different kind of vets who end up in behavior. I'm a scientist. I want to know the facts, and I want the problem solution done out the door. Whereas this is softer. It's not as clear cut. What feels that way, but what I get from speaking to you is that it's not clear cut. It's actually much more clear cut than we think. Is that right? It is more. It is a science. It's not some soft science or
absolutely right
branch of veterinary science.
Absolutely right. So it used to be, I think, that human psychology was naturally not a science at one stage, and so I think it's a bit of carryover from that as well. And with science is all about measuring things and experimenting and having variables that can be measured and hypotheses that can be tested. And the thing about behavior is that the measurements and the variables, it's just more difficult. So it can be done, it's just more difficult. There's not like just a blood test you can do that just gives you, a hematocrit that's a nice round number that you can then use. It's actually not that simple. And so especially, I think the other issue to it as well is that everyone's got an opinion and everyone intuitively thinks they knows what's going on. But there's a real sort of Dunning-Kruger effect thing here where like the less the more you think and it's in a big way in the behavioural sciences. So a lot of people think they've got it all figured out, but they just don't know what they don't know. And that's a very common experience I've seen.
That kind of leads nicely into something else I wanted to ask you about that's off topic of the behavior stuff. But when I prepared for this, I saw that you gave a talk a while ago about looking at a scientific paper or a research article or something and critically evaluating it as whether this is good science or not, and whether I should believe this, which is, for me personally, I should learn that skill, because I just go, well, if it's a scientific journal, it's obviously fact. I'll just believe what's on there. Have you got any quick takeaways on how to get better on that, or is it a long talk?
Look, I think it's not so much a quick takeaway on how to quickly get good at it. It's kind of like, speaking to a high school student and saying, a quick tip on how to be a good vet when you start work tomorrow. Like there's a lot to know. but saying that, there's some useful information. So many years in a PhD that it took me to learn to analyse a paper well. And part of it is understanding the field. If you don't understand the field in which the paper's written, if you want to critically evaluate it, that's going to be very difficult. But for you, for example, in a paper in emergency medicine, you might be able to critically evaluate that, because that's your field. And so then when you're looking at the paper, then there's a few tips that I've got. So one of them is a bit of a hang up around statistics. So you kind of just, unless you understand statistics well, you kind of just have to go on the expertise and word of the author of the paper. And that's a big leap of faith. So you can't critically evaluate a study if you don't understand the statistics used. You can't do a proper analysis of that study. And so if you don't understand statistics, I hate to say it, but it's not going to be like, that's a big gap you're going to always have. And you don't have to be a genius at it. You can learn little bits of statistics, and it's going to take a lot longer than what we've got here. But one of my biggest hang-ups is people just harping on about the number of participants in the study. So, if there's a study with 20 cats in it, for example, then someone might say, look, there's only 20 patients in this one, whereas this other study over here had 1,000 cats in it, so that one's obviously better because it's got a bigger number. And that sort of superficial look, and that's actually not even true. What matters is actually the statistical power. And so you can have a study with 1,000 cats that only needed to use 20 cats to find its solution, and then they've done experiments on an extra 920 cats for no good reason, and that's extremely unethical, because they actually could have known, after only testing a small number of cats, they could have proven far beyond a reasonable doubt that their study, they could have proven its conclusions. And so then they've gone ahead and used way more cats than is necessary. So that's one thing that can happen. And the other thing that can happen is that if they use a large number of patients to find a result, that's because there's actually hardly any effect of the actual treatment. So the reason they had to use so many animals is because it does next to nothing, and you need to test so many animals to find a small effect size. So I guess my takeaway would be that basically look for consensus across the field rather than an individual study to base things off. So if you're seeing a whole bunch of papers and they're all concluding the same thing, then you're relying on the expertise of the field. And I think that's a more important skill, is to be wide read, and to read a bunch of papers on a similar topic is actually going to be a better skill than trying to just read one paper and critically evaluate it, because it's going to be very hard to do that.
That's actually really good advice. So if you see something that you think, wow, this is amazing, it's brand new, go and confirm it. See if there's any other data that backs it up at least. Or if there's 10 conflicting papers, then probably maybe don't put too much value in any one of those papers. So back to behavior, Dennis. The other part then, so we talked about dealing with patients in clinic, but the other part then is the behavior consult. And from what we've discussed so far, these are complicated problems. There's not a quick fix. You're not going to have a 10-minute consult. And I think that's why so many of us resist it as well. What's the takeaway for the non-behavior GP vet who now, after hearing this, can't unhear it and will start spotting anxiety and problems like that? Either that, spotting something in a consult that you think, well, this might be a problem behavior, or somebody coming in and saying, my dog chews, what should I do? Or my dog won't stop barking. What do we do? What's the advice?
Look, I think that it's always important to understand that there's a range of different problems, and there's not going to be a one-size-fits-all approach. And so, there's going to be, for example, dogs that you can tell are really stressed, and the owner's saying that they're like that at home as well, and then they might not want to seek treatment. So in that situation, it's about getting the owner to empathize. So not if you're empathizing already, maybe the owner isn't. So it's often good to just spend 30 seconds saying, hey, look, see your dog's panting, they're pacing, they're barking, they're stressed and scared. So a lot of owners actually don't even know that. So if you've just learnt that and now you know it, make sure you just convey that to the owner. And it doesn't take long, but it can really help the owner come on side for trying to help the animal as well. And then the next step is, okay, well, what do you do about it? So yes, there's absolutely going to be referral is always going to be best. And if you've done that and you've gotten your owner to empathise with the patient already, then they're more likely to accept referral. But they won't always. And like I said, different patients, different people step through your door. You actually do need to make sure you have a spectrum of care available so that it's not referral or nothing. A lot of vets, I feel, they speak to a case and they're like, okay, so they didn't accept referral, so it's not my problem. I've told them about the behaviour specialist and they said no, so we can't help them and there's nothing there for them. But that is not good medicine. That's not a good spectrum of care that you're offering that patient, because what if we did that for, all of our other medical and surgical cases, we just offered them referral or nothing? You don't. You end up just doing the best you can under the circumstances. So the next best down option is to then go out and try and help the patient yourself, or have a vet in your clinic that helps the patient themselves. And so that means, yes, in a lot of cases, trying a medication that might help them feel better and feel less stressed is absolutely a good idea. And any CPD you can get on that, it's great, just so you can know a little bit more about it. But yeah, giving it a shot and understanding that it's always a trial, and just seeing how the patient responds, and get the owner back in and have a chat to them about how they're going on this medication. Don't just prescribe it and then not book any follow-ups. But then the other side to treating behaviour is your advice, your behaviour mod plan, your environmental modification plan, and all of that. So I really think that you do need to be providing something. And if you're not providing anything and just providing medications, they're going to find that advice somewhere, anywhere. They're going to Google, they're going to maybe find a trainer that uses punishment. I saw online an owner asked a question the other day about what to do with their dog that's on clomipramine and using a shock collar at the same time. I'm like, whoa, okay, so we've got a medication to reduce anxiety and a shock collar to increase anxiety. Like, what's going on here? Like, this is not good. So clients will find things to do, and we need to be providing some advice because owners really trust us. We're a real authority, and if we tell them what to do, they really trust us. But obviously, we're not going to have the time or the knowledge, though, are we, to do that in consult?
And that's that Dunning-Kruger effect again, where as a vet, I know enough to know that I don't know enough, but then because of that, I don't say anything. When people say, especially, I've got the cop out as an emergency vet. I go, look, I'm the emergency vet. You got a problem, it's not my problem. And I'll say to people, I think you should go see a behavioralist because I don't know enough to give you sensible advice. And then they go online and then they find Mr. Trainer with the shock collars and you've got to dominate, you've got to be in charge of the dog, that sort of stuff, which is worse than nothing.
Absolutely. Yeah, really bad. So then, obviously things like handouts and information sheets can be useful, but they're not that, I guess, tailored to the patient in the case. So that's also where, obviously, there's my own conflict of interest here, that I've got my website that I had it up and running for a few years, the Abadog website, that allows owners to get customised behaviour mod and environmental mod based on their questionnaire answers that they do online through our website. So it's like a custom plan for them that's not going to be as good as referral, but it's about spectrum of care. So it's providing something that's way better than Google or just a standard handout. It's going to be specific for their dog, and it will give them lots of stuff they can work on. And yeah, there's going to be owners that won't read it or won't do it or whatever, and you can't help them. But I think it's almost like a duty of care to, at least if you've provided it, then at least you've done what you can. You've led the horse to water. You can't force it to drink. And so I actually use that as a hurdle requirement for any animals going on meds, because I think that it's part of the complete treatment plan. If they're not going to take up on a referral and they're going to have medications for their patient, I feel like it's my duty of care to provide something that's going to help the patient have a more complete treatment package rather than just one little part of it, the treatment, which is medications.
Yeah, last time we spoke, and for anybody listening, we have had Dennis on the clinical podcast where we did talk about sensible medication choices and all those sort of things as well. But when we spoke last time, Abadog was your new baby. You got a real human baby on the way, but that was your new baby at the time. That's a couple of years now, a year or almost, maybe a little bit more than a year ago. How's Abadog going? What's the uptake, and what are the outcomes that you're seeing from it?
It's going really well. So I've been to a few conferences now since I've seen you and had a little booth there, and we've got a bunch of vets that are signing up. It's hard to measure usage because not every vet sees a behaviour case every day, but basically we've got a good 50 clinics around Australia that are using it, what I'd say is regularly. They're adding up to a lot of people using it, a lot of patients, a lot of vets using it, and some of them very regularly. And so it is growing nicely because I think vets realise that it's a really handy option to have in their arsenal, like up their sleeve, another thing they can do.
Quick plug for it, Dennis. How does it work again? So you've got the website, and let's say I'm in a consult, the owner asks me, or I identify that Staffy has an anxiety problem, big surprise, but I don't have an hour to talk about it. So what I do, I subscribe as the clinic or the client subscribe, who pays for what to use the service, and then a quick recap of what the service does for us.
Yeah, absolutely. So like the whole thing is designed to be like the easiest it possibly can be and to save as much time as possible from the vet's point of view. So there's a couple of ways. The easiest way is just to jump online and just use it in a consult with no prior knowledge. So if next time you have a behaviour case, you just go to abadog.com and you click the send questionnaire button. So an owner identifies that there's a behaviour problem, click the send questionnaire button. You put in the owner's email address and your email address at the vet clinic, and you just click send, and then it will do the rest. So just let the owner know that they're going to get a questionnaire sent to them for them to do when they get home. So this is the easy way of doing it. The client then pays at home online, they do the questionnaire, and then they get a customised behaviour mod plan sent to them. And you get a copy of that too, but what you also get is a history summary report based on their answers, so you can see the summarised version of the problems that this dog is having, which is a good one because taking a history can take a while for behaviour cases. So this way you've got a lot of prompts there and a lot of information that you can just plug into your history, so that's good as well. And then that's basically what the service provides, and so you then know they've got a little behaviour mod, environmental mod plan to sit alongside any medications they might be on. And then it's a good idea to get the owner back in and have another chat to them for another consult and see how the meds are going and everything else. And you'll find that a lot of what the questions that they would have asked you are already answered in the report. So if they ask a question, say, just have a look through your report, you might find some answers in there. That's basically how that works. But there is another option. You can sign your clinic up to it. And the benefit of that is that then you can actually, you get a free trials to use yourself for clinic members, or that you can send to clients for free and have a go with it. And also, and actually we might pop a link also in the show notes maybe to that if you like, and through the Vet Vault you can get some extra free uses of it, so that'll be good.
Hey, quick side note. Dennis has created a link that will give Vet Vault listeners a bunch of free extra trial runs with Abadog. So you can try it out for free in your next few behavior consults. I've put the link in the show description, so once you've parked your car, not while you're driving, please pause the audio and click on that highlighted Abadog link in the show description in whatever app you're listening to this, and it should take you straight there. Full disclosure, if you use this link, then the Vet Vault will receive a small commission each time you use the product. So you'll save time, get better results for your patients, and you'll be supporting the podcast, which I feel is a win for everyone. Okay, thanks.
And then that means that you can then send one to the client that they don't have to pay for, that you've already paid for, and the clinic can buy them at half price, and you can just bundle that into the cost of your consult. You can charge the client whatever you want for it. You can do it however you want. The benefit of that is that then if they've paid for it, they're more likely to do it. But then the downside of it is you have to spend the time selling it. So they've both got their pros and cons. Either way, it's got their pros and cons. So there's a solution for everyone. And at the core, it's easy to use. Just have to try.
I just like it because it is that. And it comes back to what we said right at the beginning. The reason we don't want to engage with behavior is I don't know where to begin. I've got to do something, but I don't know what other than referring it. So then I just do nothing. And this is something. And it's something good. It's something that you can do. And it's not time consuming. It takes that burden of, like, I've got 7 consults waiting and I still need to go do that spay. And now I've got this freaking behavior consult. This goes, here's a fast way. You're going to get all the information you need. I don't have to sit here for 40 minutes and asking you about all these things. And I'm going to forget 5 questions. So I love it. It's a great idea. We're going to get a service like this for medical problems where the client can go, well, here you go. Before you come in, do this questionnaire, and it's going to come in and tell me all the things that I should be thinking about, like an AI.
That
consult.
would be great. I think that's a really good idea for history, just for the history, so that you could have a nice little list of some of the problems that the owners identified, and then you can ask all your follow-up questions you like. But just having that to start on can sometimes speed things up. How long do you spend asking owners about different toxins, as an emergency vet that they might have come into contact with, any garbage they might have eaten, like snail bait, rat bait, whereas if they could have that all written down, then you could just say, I see here you ticked that there were no toxins, you read through those, you didn't see any, there's none in the house, and then the owner can say, yep, saw that, and you can move on. Or maybe it will find something. So
how are we not doing that already? Because you're right, it's the same consults have the same sort of questions. So come in with your gastro patient, I'm going to ask you about food and about toxins and about blah, 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 and yet stupidly we still spend 10 minutes asking the same questions. Why is it not done beforehand? Why is it not? Surely there's a AI chat GPT that could do this for me, so that by the time I walk into my console, I have my information and a little summary of, you're in Southeast Queensland, the dog has these signs, it's this old, keep in mind the following 5 DDs. It's just anyways, I've just given somebody a business idea.
It'd be great. I've thought of doing something like this for a long time, but you can only do so much in this world. There's only so many hours in the day. But yeah, it could be handy. I think the history taking is the best bit, because then they can leave being a vet to being a vet. Like, you can do all your diagnosis and all of that stuff. But if you've got a really nice history that can just speed you up, because then you got a whole bunch of information from the client that they've already given you, then I think that could be handy, really handy.
Yep. Man, Dennis, are we missing out on anything? I've loved this. I think we need to wrap up with our standard questions, but I have more time. Is there anything else that you'd like to cover, or that you like to get on a soapbox on, and anything else? What haven't I asked? No,
not at all. I think that it's been really great. I love my fellow vets in the profession. I think, everyone's doing such a great job, trying to be the best they can. And I hope I've just opened a few people's eyes to the world of behaviour a bit more, and people don't need to feel bad about not doing it. They need to just start trying to improve. That's all. Focus on the solution, not the problem. Stop worrying about how bad you are. Start spending a bit of time trying to improve on it.
I had a thought this morning exactly on that. I was listening to a book and talking about, it's a book about leadership and about leading teams. And one of the things is we want to keep being better, but on the flip side, there's that idea of we also should be satisfied with what we're doing. And I was thinking about how do you balance the desire to be better, but also being satisfied with where you are. And that's a challenging thing. But I think I came up with a saying. I'm going to have to think about this. What did I think? You are always good enough, but you're never as good as you could be. Is how I'm going to look at it from now on. Good enough, but I haven't reached my potential. And that you'll never reach your potential because it's a moving goalpost.
Yeah. Sounds good to me. I like it. I think so.
So the pass along question, I stuffed up. So this is where I get the guest to ask a question for my next guest. But then at my interview yesterday, I forgot to ask the question. I gave them the question and I liked the answer so much that I forgot to ask. So I tried something this morning. I thought, well, if I don't have a guest to ask a question, to give me the question to ask, I'm going to ask ChatGPT. So I gave it this prompt. I said to ChatGPT, I have a podcast for veterinarians where I interview vets and people associated with the profession to help vets create sustainable careers. One of the questions I usually ask is to answer a question from the previous guest. Can you pretend to be a guest on my podcast and give me your question for my next guest, keeping in mind that you are likely a veterinarian or somebody associated with the profession and that the next guest will also be? ChatGPT said, sure, I can help with that. As a professional in the veterinary field, we often face challenges that test not only our technical skills, but also our emotional intelligence. Can you share an experience where you faced a particularly challenging situation, how you navigated through it, and what lessons you learned that could be beneficial for other veterinarians in their practice? There we go. The ChatGPT. This could become a section, the ChatGPT question.
What I should have done is I should type that into ChatGPT now and get it to give me an answer to tell you. How's that?
Gold.
No. Look, I think ChatGPT is amazing, but it's I don't think people need to be completely as freaked out as some people are. I don't think it's replacing us anytime soon. But look, challenging situations as a vet. As a new grad, it was tough as a new grad. When I was a couple, 1 or 2 years out, I still remember, I had my friends, I was working in my clinic, but I still felt very isolated at the time. And I think I was struggling with connecting with people as well as I could have. And I think it was related to my own mental health, actually. And it was a tough time. I think a lot of people, would you agree, can feel isolated despite being around people, like feel alone, yet being in a bustling, busy practice and all that. It can be hard. And I just think that what I got out of it is that I did have that mindset of wanting to grow and wanting to change, and knowing that if I didn't change anything, things would just stay the same. And so I started my own journey of mental health around then, which I'd sort of been oblivious to it my whole life. And I feel like I'm in a much better, happier place now in life than I was then. And it's never easy, but I just like to say it's worth trying to learn what, like with the Dunning-Kruger, you don't know what you don't know. That even applies to your own brain and your own thoughts and your own mind. And so much so that the stuff I know now about myself, like, it's just amazing compared to what I knew about myself 20 years ago. Like, I have a completely different outlook on myself. And so that mindset, that growth mindset of wanting to learn about yourself and who you are, and just to help yourself as a person to be happier and more wholesome for the rest of your life, and dedicating a bit of time to it. And I think it's just a really worthwhile thing. And that's one thing I've learned from a tough time.
So when you said you were struggling to connect with people, do you mean your colleagues or friends or people? So you're not talking about clients, you're talking about your support network or your potential support network.
Personally, it was sort of everyone. Like, I think I was sort of withdrawing and isolating myself, due to being, I think, a little bit depressed and going through a lot of stress at the time.
Were you, or are you, an introvert, Dennis?
I don't know about introvert extrovert. I think that I personally I believe that I may be a little bit autistic, and I've struggled a lot socially younger in life, and I sort of had to learn a lot of my social skills rather than just have them intuitively, which I do understand makes me seem a little bit weird to some people because I'm not just behaving naturally, but I think a lot of vets are in the same boat as me, and there's nothing wrong with it. It's just about learning. I think I still remember that I was really struggling to make eye contact with clients as a new grad, really struggling to look them in the eye. Just felt really uncomfortable. And it's easy now, but it was something I had to learn because people expect it. It's normal.
Yeah, that's why I'm asking, because I feel like we are like that, right? Again, I always stereotype the typical vet student, but often intelligent and many skills, but social skills not top of the list. And which is stressful because that's what you do. You're in front, and I found the same. People always laugh when I say I think I'm a bit introvert because I have a podcast, but I find it wearing to spend all day talking to strangers. I can do it well, and I've got skills, but it's exhausting. And it was much more so as a youngster because you've got the added pressure of I've got to perform, I've got to seem smart, even though I feel like I know nothing, and then be this outgoing, connected human being. And I think it's one of the things that makes it so hard. Do you have any short advice on how to get better at that for somebody who's listening to this going, yeah, shit, yeah, I find that really hard?
Yeah, I'll first say, I completely agree with you on the social exhaustion side of things. I think that I didn't realize it for a long time, but on the days when I was consulting and seeing client after client after client, I did really well for the first 4 hours socially, really, really well. And I didn't even realize that for the second half of that shift, for the next 4 or 6 hours, that I was actually performing much worse socially, much, much worse, because I was exhausted mentally from the tire of having to do it. And so I think even just identifying that in yourself can help give yourself a bit of a break and not being so hard on yourself, realizing that that's a normal thing that can happen to anyone and that there's nothing wrong with it. And that then if later in the day you do find that, geez, that you just feel like you're just going through the motions and that you're not connecting to clients or whatever, that you've got a reason for that. And it's not that you're a bad vet, it's just you're tired. And if you could have 4-hour shifts every day, you'd be fine. Like, that's my example for me. But, it's just, I think knowledge is power with this kind of thing. And really, it's like I said before, that introspective journey into your own mind can be really useful. Trying to figure out, spending time figuring out why things are going on. There's another podcast actually that I think you mentioned before that you might ask me about other podcasts out there.
Yeah, let's jump straight into that. That's the next question. What podcasts are you listening to?
Let's go. So there's one that I really like personally. I was and am a little bit of a computer gamer at times. And so there's a podcaster called Healthy Gamer GG. And he is actually a Harvard psychiatrist that does a little bit of gaming on the side. But he's a Harvard psychiatrist, and he is a very, very smart man that does these podcasts about mental health. And apart from little side quotes about games that come few and far between, pretty much the podcasts are mostly just on mental health and the struggles and challenges of life. And I find that his insight and his understanding are amazing. And I've actually learned stuff off him that I think has made my animal behavior knowledge better as well, because of how I feel how deeply he understands the human mind. And yeah, I think it's been really beneficial listening to a lot of his podcasts.
Cool. That sounds like one that's definitely going on the list. Game. I have zero interest in games, but maybe I should listen to it just so I can understand, because I've got kids who obviously want a game, but I'm like, no, games are bad. And maybe I should broaden my horizons and see, can you be a healthy gamer?
Yeah, it's a mental health podcast. It really is. It's just, it's got the computer gamer, how can I say it, marketing aspect to try and get gamers to use it. Like, that's pretty much all it comes down to. And when you listen to it, like, you don't need to play games at all to get so much out of it. So much.
Okay, gold. All right, your last question, and maybe we answered it already in our previous discussion, but you have an opportunity to speak to all the vet new grads of the world. Maybe it's this podcast, if we can get all of them to listen, and you've got a couple of minutes to give them one little bit of advice. What is Dr. Dennis's advice?
I would just say, and this is a bit biased, do some behaviour CVE. Go do a fear-free certification, like just a little bit, because you've been disadvantaged by graduating from a vet school curriculum that just doesn't put enough time into behaviour, and just I think you'll get out of it so much more than what you put in. So I think just do it.
Are there other similar things to the fear-free? I've seen discussions online about should I do fear-free? Are there other options? Is that the, because it's tried and tested, and I know lots of people speak really highly of it, but are there similar things?
Good question. I don't know. I actually don't know. Yeah, so I'd say that there's lots of like CBE courses and stuff on behaviour. There's just the behaviour streams at the conferences. You know, a lot of the conferences have got amazing behaviour streams that you can go along to, and they're really entertaining, really interesting talks, and they're pitched for general practice vets that, you know, don't know too much about behaviour, and yeah, we're all really friendly and happy to answer all your questions, so you should absolutely come along.
It's so funny because it's that classic thing of you'd want to go to the things that you know about and kind of avoid the things you feel stupid. So at a conference, I always see the behavior stream, and I normally don't go because I go, yeah, it's not my thing. So let's talk more about emergency, the stuff I'm good at already, and maybe sometimes opening your mind a bit and going, maybe I don't like behavior because I know nothing. Let me go and dip a toe in the water.
Absolutely, that's my advice. You well summed up.
Dennis, thank you so much for this time. Every time I chat to you, I have a shift or a light bulb moment. So thank you for doing it, and thank you for chatting to us again. And I hope that a couple of other people have some paradigm shifts.
Yeah, me too. Absolutely. I always love having a chat about this kind of stuff. So yeah, thanks for having me on.
Before you disappear, I wanted to tell you about our new weekly newsletter. I speak to so many interesting people and learn so many new things while making the podcast. So I thought I'd create a little summary each week of the stuff that stood out for me. We call it the Vet Vault 321, and it consists of, firstly, 3 clinical pearls. These are 3 things that I've taken away from the clinical podcast episodes. My light bulb moments, the penny dropping, any new facts, and the stuff that we need to know to make all the other pieces fit. Then, 2 other things. These could be quotes, links, movies, books, a podcast highlight, anything that I've come across outside of clinical vetting that I think you might find interesting. And then, 1 thing to think about. I'll share something that I'm pondering, usually based on something that I've read or heard, but sometimes it'll be just my own musings or rants. The goal of this format is that you can spend just 2 to 3 minutes on the clinical stuff and move right along if that's all that you're after. But if you're looking for content that is more nourishing than cat videos or doom scrolling, then our 2 other things should send you in the right direction. And then something extra for when you feel like a slightly longer read. If you'd like to get these in your inbox each week, then subscribe by following the newsletter link in the show description wherever you're listening to this. It's free, I think it's useful, it's fun, and it's easy to unsubscribe if it's not for you. Okay, we'll see you next time.